Hi, my name is Omaira Geraldo and this is the Unit 4 of the Professional English in Use. Chapter 24 Infections 24.1 Match the two parts of the sentences. Look at A, B, and C opposite to help you. 1988 saw the UK launch of live attenuated. This is the J, measles, mumps, and rubella MMR vaccine. 2. Chickenpox, varicella, is a common infectious. This is the E, disease of childhood. 3. Rabies has an incubation. This is the A, period ranging from 4 days to many months. 4. The patients remained febrile. This is the H, with peaks of temperature of 39.5 degrees Celsius. The 6. Quite a proportion of patients who recover from hepatitis B. This is the C, become carriers of the virus. 7. The central part of Africa is in the midst of an epidemic. This is the F of AIDS. A. Measles rubella is must. D. Infectious during the catarrhal stage. 9. Lyme disease is caused by transmission. This is the G of B. Purgatory from animal to man by exotic ticks. 10. PUO stands for I. Pyrexia of unknown origin. 24.2. Complete the case report on the patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate was 100 minutes. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking a febrile regularly. The diagnosis was confirmed by the presence of glandular fever in his blood film. 24.3. Complete the sentences. Look at A, B, and C opposite to help you. 1. An infection which can be treated successfully with antibiotics is curable. 2. Another word for an epidemic is an outbreak. 3. Bacteria and viruses are examples of microorganisms. 4. Someone whose temperature is normal is afebrile. The common infection with Epstein-Barr virus is known as glandular fever. Chapter 25 Mental Illness 25.1 Complete the table with words from A, C, D, and E opposite. Noun, affect, anxiety, behavior, dementia, disturbance, suicide. Adjective, affective, anxious, behavioral, demented, disturbed, suicidal. 25.2 Make words combination using a word from each box. 2 words can be used twice. Look at B, C, and E opposite to. Behavioral syndrome. Eating disorder. Major depression. Mental retardation. Personality disorder. Psychomotor retardation. Sleep disturbance. Substance abuse. 25.3 Complete the sentence. Look at A, C, D, and E opposite to help you. 1. The way a person behaves in his or her behavior. 2. A persistent emotional state is a mood. 3. A sudden attack of anxiety is a panic attack. 4. The form of dementia associated with aging is called senile dementia. 5. A disorder which is not associated with pathological change is functional. 6. An idea which forces a patient to repeat unnecessary action is a compulsion. 25.4. Which symptoms of depression was this patient suffering from? Look at C opposite to help you. Case 31. A 56 years old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. Tiredness, fatigue, loss of interest, sleeping poorly, insomnia. Chapter 26, The Nervous System, Part 1. 26.1. Complete the table with words from A, B, and C opposite. Adjective: blind, conscious, deaf, dizzy, numb, light-headed, unsteady. Noun: blindness, consciousness, deafness, dizziness, numbness, light-headedness, unsteadiness. 26.2. Make words combination using a word from each box. Look at A, B, and C opposite to help you. Double vision, epileptics, fit, prodromal symptoms, syncopal attack, urinary incontinence, visual acuity. 26.3. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's questions. Look at C opposite and the table in 26.1 above to help you. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Do you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movements while you were unconscious? Chapter 27, The Nervous System, Part 2. 27.1. Complete the table with words from A and B opposite. Noun: absence, diminution, flaccidity, spasticity, wasting. Adjective: absent, diminished, flaccid, spastic, wasted. 27.2. A doctor is giving instructions to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. 1. I'd like you to relax. I'm just going to move your arm up and down. Muscle tone. 2. Can I see your hand? Muscle bulk and possibility involuntary movements. 3. Now I'm going to straighten your arm out. Try to stop me. Power. 4. Can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. Coordination. 27.3. Complete the sentence. Look at A, B, and C opposite and add the table in 27.1 above to help you. 1. A flaccid hand drops limply to form a right angle with the wrist. Wrist reflexes are reflexes that are stronger than normal. 3. Muscle wasting means the muscle is reduced in bulk. 4. A tic is form of involuntary movements. 5. Key is often used to test the Babinski response. 6. His coordination was poor. He could not perform rapid alternating movements. 7. A reflex hammer is used to test reflexes. A. When something is diminished, it is less than normal. 27.4. A patient is brought to A and E in coma. When her name is spoken, she opens her eyes, but she does not answer questions or obey instruction. What is her GCS score? GCS 5. Eye opening to speech 3. Verbal response none 1. And motor response none 1. Chapter 28 Oncology 28.1. Complete the table with words from A, B, and C opposite and related forms. Verb: cure, excises, grow, invade, obstruct, palliate, palpate, spread, swell. Nouns: cure, excision, growth, invasion, obstruction, palliation, palpations, spread, swelling. Adjectives: curative, growing, invasive, obstructive, palliative, palpable, spreading, swelling or swollen. 28.2. The notes below are about the patient described in B opposite. Use them to put the sentences in the correct order. To make the next paragraph on the case report, use Appendix 2 on page 20 if you need help with the abbreviations. The first is 6. On examination, his temperature was 37.2 degrees Celsius. Second is the 3. There was a smooth, from 3 by 4 centimeters, mass in the right supraclavicular fossa. Then the 7. There were enlarged lymph nodes in both axilla and inguinal areas. Then 2. His mouth and throat were normal. The next is 8. His pulse rate was 100 min, regular, and blood pressure 112/66. Then is the 4. His cardiovascular and respiratory system were normal. Then is the 5. On abdominal examination, there was a mass palpable 3 cm below the left costal margin. And the last is the 1. Examination of the central nervous system was normal. 28.3. Complete the sentence. Look at A, B, and C opposite to help you. Distant spread of tumor cell is known as metastasis. 2. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. 3. The opposite of painful is painless. 4. A malignant neoplasm is called a cancer. 5. Tumors which do not invade or metastasize are benign. 6. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis. Chapter 29. Pregnancy and childbirth. 29.1. Complete the sentence. Look at A, B, and C opposite to help you. 1. A baby that is born a week before the EDD is premature. 2. A termination of pregnancy may be necessary for medical reasons. 3. The first 3 months of pregnancy are known as the first trimester. 4. Fetal distress in the first stage of labor is an indication for caesarean section. 5. It was a breech presentation and delivery was by forceps. 6. A miscarriage is another term for a spontaneous abortion. 7. The cord was wound tightly around the baby's neck and it was unfortunately a stillborn. 29.2. Complete the table with words from A opposite. Birth, abort, deliver, induce, miscarry, present, terminate. Noun, abortion, delivery, induction, miscarriage, presentation, termination. 29.3. Dr. Bennett, an SHO, is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of verbs from 29.2 above. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she had a pregnancy when she was 18, which was terminated, and another one a year later, which spontaneously aborted. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The third baby presented as a breech and was delivered by cesarean section. Chapter 30. The respiratory system. 30.1. Make word combinations using a word from each box. Look at A and B opposite to help you. Blood stained. Breathe sounds. Pleural rub. Productive cow. Vocal resonance. 30.2. Rewrite the question using words that are better known to patients. Look at A opposite to help you. Is your cough productive? Do you cough up any phlegm? What color is the sputum? What color is the phlegm? Is it ever purulent? Is it ever yellow? Have you ever had hemoptysis? Have you noticed any blood in it? Do you suffer from dyspnea? Any problems with your breathing? 30.3. Are the following statements true or false? 1. A patient who has a loose cough produces phlegm. True. Crackles are heard when the airways are narrowed. False. A patient who has a non-productive cough produces sputum. False. Wheezes are typical of pleurisy. False. A pleural roof is a sign of asthma. False. Chapter 31. The skin, part 1. 31.1. Complete the description of herpes zoster, shingles, by replacing the medical words in brackets with ordinary English words. Look at A and B opposite to help you. Shingles, herpes zoster, usually starts with pain and soreness, then red spots, macules appear that develop into groups of small blisters, vesicles, over a particular area on one side of the body. In most patients, new spots, lesions, continue to appear for 3 to 5 days. The small blisters become filled with pus and then form scabs. In severe cases, there may be scars afterwards. 31.2. Read the description of the rash of rubella and complete the notes. Look at A and B opposite to help you. The spots are scattered pink macules, which appear first behind the ears and on the forehead. The rash spreads rapidly, first the trunk and then to the limbs. Location and distribution. First behind the ears and on the forehead, then the trunk and limbs. Grouping, scatter. Type of lesion, macules. Color, pink. 31.3. Complete the notes for the rash in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution. Widespread on the chest and abdomen. Type of lesion. Small macules with some scales. Color pink. 31.4. Complete the notes for the lesion in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution. Below lateral angle of the left eye. Grouping, single. Type of lesion, nodule. Color, white/pink. Chapter 32, the skin part 2, 32.1. Write the corresponding medical terms for the ordinary English words and say what kind of force is involved. Look at A opposite to help you. Common word, bruise, cut, graze, scratch, stab wound, tear. Medical term, hematoma, incised wound, abrasion, linear abrasion, penetrating wound, laceration. Type of force, blunt, sharp, blunt, blunt, sharp, blunt. 32.2. Choose the correct words to complete the description of the injuries shown in the illustration. Look at A and B opposite to help you. There are grazes above the left eyebrow and on the left side of the neck. A contusion to the left side of the lower lip and tears to the left cheek. 32.3. Write a description of the injuries shown in the illustration. Look at A and B opposite and at 32.2 above to help you. There is a laceration on the left shoulder and an incised wound approximately 6 centimeters in length above the left nipple. 32.4. Complete the sentence. Look at A, B, and C opposite to help you. Frequent change of position are necessary in the immobile patient to prevent the development of a pressure sore. 2. He had several penetrating wounds in the abdomen from the knee. 3. He was knocked unconscious by a heavy blow to the head. 4. The wounds were only superficial and required no treatment. Chapter 33, the urinary system. 33.1. Look at the conversation in A opposite and complete the notes about Mr. Jones. Use medical terms where possible. 1 is frequency, 2 nocturia, 3 dysuria, 4 hesitancy, 5 flow, and 6 dibbling. 33.2. Match the patient's description of their symptoms with the medical term. Look at A opposite to help you. I have to pee every half hour or so. B. Frequency. 2. I get a scalding pain when I pass water. A. Dysuria. 3. I have to get up several times to pass water or at night. E. Nocturia. 4. I have to rush to go to the toilet. F. Urgency. 5. I have trouble getting started. D. Hesitancy. 6. I can't hold my water. G. Incontinence. And 7. I passed some blood in my urine. C. Hematuria. 33.3. Write the doctor's question for each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own question for urgency. Urgency. Do you have rush to get to the toilet in time? Dysuria. Do you get any burning or pain when you pass water? Frequency. How often do you pass urine? Nocturia. Do you have to get up at night? Hesitancy. Do you have any trouble getting started? Incontinence. Do you ever lose control of your bladder? Hematuria. Have you ever passed blood in the urine? 33.4. Describe the findings of the laboratory report in words. Look at B opposite to help you. Blood plus protein, triple plus, and cast nil. There was a trace of loss, proteinuria, and no casts. Chapter 34, Basic Investigations. 34.1. A doctor is talking to a patient during an ophthalmoscopy. Match the underlined expression she uses. Two expressions with similar meaning from A opposite. 1. A couple of drops is the B, a topical myadratic solution. 2. Which will make it easier for me to see the retina, is the C, to aid dilation. 3. I need to get rid of as much external light as possible. This means closing the blinds. Is the A. The examination is done with dimmed lights. And 4. Look straight ahead at the clock. Is the D. Fixate on a target. 34.2. Complete the instruction. Look at B opposite to help you. Wrap the cuff around the patient's upper arm. Place the diaphragm over the area of the brachial artery. Raise the patient's arms so that the brachial artery is at the same height as the heart. Close the valve on the pump. Pump up the pressure to at least 115 mmHg. Open the valve a little and slowly deflate the cuff while listening and watching the pressure gauge. 5. The first sound you hear is the flow of blood through the brachial artery. The value on the gauge at that point is the systolic blood pressure. 6. Continue listening while you slowly deflate the cuff. 7. The diastolic blood pressure is measured when the sound completely disappears. 34.3. Complete the text. Look at C opposite to help you. Phlebotomists are specially trained in taking blood. They are skilled at venipuncturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. If it is difficult to locate a suitable vein, the patient may be asked to make a fist, or a tourniquet may be applied on the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising at the site. It is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory, where a full blood count or other investigations will be carried out. This is all of my part, and thanks for the attention.